Hello and welcome. We are going to give this just a minute to make sure that we allow as many attendees as possible to join the webinar right now. And also, we're going to be live streaming this. And I just got the notification that it is being live streamed to Facebook right now. So we're past the point where we're waiting for everything to work. Hello and welcome. Good morning, good afternoon, good evening, wherever you happen to be, whatever time it happens to be where you're watching this. My name is Shane Watson. I am the Public Information Officer for notMYkid and also a prevention specialist for the organization. Today is World Suicide Prevention Day, a global observance that's not only about increasing awareness of suicide, but increasing people's ability and readiness to do something about it, to prevent it, to intervene if somebody's already having thoughts or feelings of suicide. And I'll say this, obviously, the topic of suicide is a serious topic. For most people, it's a pretty heavy topic. But I want to encourage you because we are here for a very good reason. We are here for a positive reason because we can do something about this. And we're going to equip you with that knowledge, the tools, the resources, the skills today for you to be able to make a difference in the life of someone who may be struggling with thoughts or feelings of suicide. Before I let my co-host introduce herself and I do my full introduction, we want to bring your attention to a couple quick things. Sarah just said hello to all of you in the chat box. We will have a few interactives during this presentation where we're going to be soliciting your thoughts, your feelings, your opinions, experiences, taking answers from you. You will use the chat box for that. When we are done with the main presentation, we want to make sure we set aside time for Q&A. We will use the chat box for Q&A after we're done with the main presentation. And there is also a Q&A button on the toolbar that we will use to make sure that we answer your questions. So before I get into my full introduction, I would like my co-host, Chief Operating Officer of notMYkid, Sarah Grado, to introduce herself.
Great, thank you. Hello, everybody. Thank you so much for coming. My name is Sarah Grado. Like Shane said, I'm the COO of notMYkid, and I have been working in prevention and with notMYkid for about 12 years now. I have been doing suicide prevention with teens, parents, school faculty, all over the state of Arizona for quite a while. I am a Safe Talk trainer for those of you who are familiar with the Living Works programs, also assist trained. So yeah, I'm really excited to be here.
Thank you, Sarah. As I mentioned in my introduction, my name is Shane Watson, Public Information Officer and Prevention Specialist for notMYkid. I've been with notMYkid 8.5 years. I've done over 600 speaking engagements throughout the United States, and I am passionate about youth mental health and wellness. I am passionate about prevention. In addition to my staff duties for notMYkid, I educate on a variety of topics, including things like substance use, bullying, safe social media use, teen stress and anxiety, and today's topic of suicide. My connection to this topic has three distinct parts. Number one is through my work with the organization. During the last 8.5 years, I've had the opportunity to work directly with local and national mental and behavioral health care professionals, local students, families, parents, schools, community groups, and I've seen firsthand what this challenge looks like in the United States and in Arizona specifically. Also on the professional level, I am a registered ASSIST suicide intervention trainer. ASSIST is an acronym that stands for Applied Suicide Intervention Skills Training. It's a 2-day, 14-hour suicide intervention workshop that is the industry standard. It is taught to crisis line workers, first responders, and it is taught to the military. My second connection to this topic is a very personal one. I'm the survivor of a suicide attempt, November 28th, 2011. I'd been struggling with substance use disorder for a number of years, was encountering major financial issues, had several family members die in a very short couple year period. And the stressors added up to a point where I nearly ended my own life. And if you've done the math in your head and you've thought November 28th, 2011, that's not quite 10 years yet, you're absolutely right. But in the 9.5 years that have elapsed since then, my life has changed immeasurably for the better. I am working in a field that I am truly passionate about, that is a calling for me. I am now 9.5 years in recovery. I am 9.5 years sober in personal recovery, and I'm the very proud dad of an amazing little girl, and that's my third connection to this topic. Like many of you, I'm a parent. I'm the very proud dad of an amazing child, and I want to equip not only my family with the tools, the knowledge, the resources to prevent and intervene in suicide, I want to be able to do the same for you. Prevention works. We've seen the positive effects of it firsthand in families, schools, community groups that we have worked with. If you're not familiar with our organization, we were founded 21 years ago by a Scottsdale family, Debbie and Steve Moak, who went through a personal behavioral health challenge with their own son. And on paper, he looked like the perfect kid. He was a scholar, an athlete, a student leader, had loving parents. And they found out that he was struggling with substance use issues. They got him help, got him on the road to recovery. He's doing great. He's using his experience to help others today. But they felt like their job wasn't done. They said, okay, we've resolved our issue, but how many other families out there are in the same boat we were in that love their kids, spend time with them, pay attention to them, but are completely caught off guard when they find out that their child is dealing with a mental or behavioral health crisis? So you look at that top left-hand column. We were founded around that topic of substance use, but we've since expanded out to include everything that you see here on the screen for two main reasons. Number one, when you see challenges like body image, depression, self-injury, suicidal thoughts, bullying, there is not a middle school or high school in the United States of America that you can walk into where there aren't students dealing with these issues. That's reality. This is the reality of the middle school and high school years. The second reason we educate on all of these is they're often interconnected. Very frequently, when we meet a young person that's struggling with one of these, they're at greater risk to struggle with another one, or they may already be challenged by another one. And in educating on these topics, we want to reach youth and adults, because if we're only reaching one of those two groups, we're doing half the job. But if we can educate and empower both of those groups, get them on the same page, working together, communicating, we can create positive change. And I'm going to let Sarah talk about our full continuum of care.
So many of you are probably familiar with notMYkid as a prevention provider, which we still are, but we also now have the full continuum of care. And so while we are still delivering prevention all over the state through our 1-hour presentations, our evidence-based curriculum, life skills curriculum, we also offer early intervention programs like Project Rewind. We do peer support with state certified peer support specialists. And then moving down the continuum, we have outpatient treatment center for youth and families. And so those are some new programs and services we really want to get out there, raise awareness about. We're, welcoming the youth and the families here. So, as somebody is identified, maybe in a prevention program that they need a little more support, that is something now that notMYkid can offer in walking them through this continuum, getting them the support that they need. And so if you are interested in any of these programs, Shane and I will be talking a little bit more about it at the end of the presentation, but just know that notMYkid now is that full continuum care provider, and we can provide lots of programs and services for families.
And beyond what you see here on the screen, we have some exciting news. notMYkid has moved into a new to us 13,000 plus square foot facility called The Well. And it is not only going to provide the programs that you see here, we are going to be expanding out to include a wide variety of wellness programs like yoga, meditation, art therapy, things like that. We're going to be having some events later this year related to The Well, and probably going to be doing an official grand opening sometime in the new year. So we're going to go even beyond what you see right here on the screen. Getting into today's topic, we want to make sure we answer these questions by the time we're done here today. Number one, how common is the behavior that we're going to be talking about here today? Is it occurring enough in preteens and teens that we need to have this conversation? The short answer is yes. What are the myths surrounding suicide? We are going to dispel some long-held myths, not to shame anyone who believes those myths, but because research over time has proven again and again that those myths aren't true, and because holding fast to those myths can provide an obstacle to us helping someone as much as they need us to help them. What are the red flags? What do we look for? What do we keep an eye out for? And when we see those red flags, how do we respond, and how do we protect our kids? If you are a stickler for sources like me, as we're quoting statistics or percentages or information, and we're going through this, if you're asking yourself, is this coming from reputable sources? The answer is yes. When we crafted this presentation, this information here, the primary sources we used are the ones that you see right here on the screen. So one of the questions was, that we wanted to answer. You saw on that slide, the guiding questions was, how common is this behavior? And we created this slide to show you that this is common enough and frequent enough. We absolutely need to have this conversation about it. You see, according to the CDC, suicide is the second leading cause of death in the United States for ages 10 to 24, 10 to 34. Second leading cause of death is something that we can do something about. It's something we can intervene upon. It's something we can prevent, or at least attempt to prevent. And we saw an upswing between 2007 and 2018, but this didn't stop in 2018. Both nationally and locally, notMykid is based in Arizona, we have continued to see an increase. We already had this increase occur between 2007 and 2018 pre-COVID. Now, when we have the pandemic that we are dealing with, not just the virus itself, but the response to it, the shutdowns, this social disconnection, the loss of social support systems, kids losing their extracurriculars, kids not being able to play sports, kids not being able to go and see their friends in person. This is taking a toll on all of us collectively, even us, adults who have fully developed brains that help us weather these storms, adults that have the body of experience that allows us to get through these difficult times and look back and say, what has helped me in the past when I've gone through this? How much more challenging is this for young people? How much more difficult is this for our middle school and our high school students? Now, when we see those statistics, when we see these big percentages and big numbers, the number of attempts that we see in the United States per year or things like that, they're intense. They're big numbers, but they're numbers. Sometimes when we look at a statistic, it's easy to forget that every one of those digits, every one of those numbers is someone's child. So sometimes we need to focus in on just one of those. And in doing that, we're going to share the story of a young man by the name of Matthew Burdett. We do not tell this story to shame Matthew's parents. We do not tell this story to shame Matthew's school. We tell this story because it ended in an absolute crisis. And the only good that can come out of a story that ends this way is we can use it as a case study. We can look at it and we can say, what do we do differently so this never happens again? Matthew Burdett was a 14-year-old student at school in San Diego, California. One day in class, he was doing something he wasn't supposed to be doing. He was eating sunflower seeds. He was kicked out of class, and the first mistake upon review that we can see was he was given no direction where to go. He wasn't told go to the principal, go to the counselor, go to the social worker. He was told get out. He wandered the halls of that school for a little while and ended up in a school bathroom. A few minutes later, a classmate of Matthew's ended up in that same bathroom, and Matthew was in one of the bathroom stalls. From the adjoining neighboring stall, that classmate recorded Matthew over the top of the stall with a cell phone camera. In that video that the classmate recorded, that classmate claims that Matthew was masturbating. The classmate then electronically distributed that video to kids throughout the school, and as you see up top on this slide, if that wasn't enough, posted it on Snapchat, Vine, and other social media sites for the world to see. I put myself in the shoes of Matthew Burdett at the age of 14. If in junior high school, I had even had a half dozen classmates whispering to one another that I had supposedly done what they were saying he had done, I would never want to go back to that school again as a 14-year-old kid. I would never want to see those people again. How much bigger is that impact when we talk about a potential audience of millions and that image, that video going out where there is a digital footprint that might never go away? Mistake number 2, and this is a huge one that you see down at the bottom of the screen. The school knew about the existence of the video, but did not inform Matthew's parents. Perhaps the most powerful tool that we have in prevention, early intervention, mental health, and behavioral health is communication. A 30-second phone call can be life-saving. Matthew's parents were never notified by the school. So Matthew goes home, and his parents can tell he's beside himself. He's absolutely depressed. And they don't know what's going on because he won't tell them, because he's ashamed and he doesn't want them to feel ashamed. He thinks they're going to feel ashamed. So he goes back to school. The video is continuing to circulate. It's continuing to circulate on social media. Kids are pointing and laughing. The video's becoming even more widespread. He goes home, back to school, rinse and repeat. And no one comes to Matthew's aid the way that he needed. And as you see under his photo, He took the way out that he thought was going to end his pain. And as a father myself, I don't know if I can think of a worse thing than if my child was hurting that much. I didn't even know what was going on. I couldn't help her. And she took that way out. Where Matthew's parents could have benefited from what you're learning and going to learn today is regarding phrases that he used in communication with them. Matthew used phrases like, I have no friends, I can't do school anymore, and I don't want to kill myself, but I have no friends. Those first two, I have no friends and I can't do school anymore, can be indirect references to suicide. No direct references to death or dying, but someone could be using that as coded language with something more behind it. But a quote like, I don't want to kill myself, but I have no friends, that is a very direct reference to suicide. Now, he said, I don't want to kill myself, but I have no friends. The second half of that sentence negates the first half. And the moment that any child, anyone, makes physical threats against themselves or others, it requires immediate response on our part. The state of California saw this situation as so egregious, and there's such a failure on multiple levels here. They have actually enacted legislation in response to Matthew's stories. So I'm going to turn it back over to Sarah, and she's going to talk about some popular myths. And as we said earlier, research has shown these are not true, and they can be obstacles to helping someone as much as they need our help.
Yeah, so the first myth that we have up here is people who talk about suicide are just seeking attention. Sometimes people will dismiss somebody talking about suicide, thinking that, well, if they're talking about it, then they're not really going to do it. And, just as Shane said, that's an absolute myth. There are, people who do talk about it openly who are seriously considering suicide. And so that's not a reason to ever dismiss it. Sometimes if somebody is considering suicide, they might be talking about it openly so much because they have been thinking about it for a while, and it has become such a real thing in their lives. And then another myth is once a person becomes suicidal, that they will always be suicidal. And so that is not a myth. There may be times where a person has thoughts of suicide and they're able to talk about that and get help for that in whatever way looks, is going to help them. And then maybe down the line, they never have thoughts again. But also a person might have thoughts and then be able to talk about it. And then down the road might have thoughts again. And the point behind that is to always make it okay to talk about, always leave that door of communication open. But just because somebody does one time doesn't mean that they're doomed for the rest of their life. Another myth is that, if a person decides that they want to die by suicide, that there's nothing that we can do to stop it. And that's a huge myth. As long as they are still here on this earth, there is something that we can do to stop it. So intervention can happen at any point. And then the last one is that talking about suicide will only just increase the likelihood. Unfortunately, we hear this myth a lot, and the kind of how we feel about it is not talking about it is one of the most dangerous things that we can do. We need to make it okay to talk about so that the people who are having thoughts feel that they can go and get help for that. Shane, do you have anything you'd like to add on that?
Absolutely. Very few challenges in life can we make better by not talking about them. As a matter of fact, if we are the one that is bold enough to start that conversation with someone who's struggling and ask them, are you thinking about suicide? The mere fact that we are clearly paying enough attention and we see that level of hurt in them, the way that can lift that weight off of that person to not have to say those words themselves, that in and of itself decreases the likelihood that they will attempt or complete suicide. I'll say this, these myths all come from a very well-intentioned place. These myths come from a place of, I don't want to make this situation worse. That last one, talking about suicide, will only increase the likelihood of the person doing it. That is something that before I worked in the field of prevention and mental and behavioral health for youth, I believed that. And it was just simply a thing of, I don't want to put that idea in their head. Research has shown time and time again, we're not going to give them that idea. As a matter of fact, as I said earlier, if we bring it up and they have been thinking about it and nobody else around them has recognized that hurt in them, they may finally not feel alone when we're one that's taken the time to ask that difficult, that challenging question. Well, it's important to understand things that increase the likelihood that a young person or a person in general is going to attempt, consider, or complete suicide. They're called risk factors. Risk factors are things that increase the likelihood that someone is going to consider, attempt, or complete suicide. And it's important to know what these risk factors are. Now, this list on the screen is by no means an exhaustive list, but these are some of the main ones. We share this with you for multiple reasons. One of them is because if you are going through this checklist in your mind related to someone you know, and you're going check, 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 the more of these categories that someone falls in combination, the higher the likelihood that they are at risk for behavioral health challenges, mental health challenges in general, and suicide specifically. Recognizing that they are at greater risk, there's a couple things that we need to do. Number one, have those preventative conversations before they're ever struggling with those thoughts of suicide. Lay that groundwork of connection and communication. Let them know, I care about you. I am here for you. If you are ever struggling with anything, you need to talk. You're stressed, you're angry, you got a big decision to make, you're hurting. Come get me. I will sit down and I will listen without judgment and with empathy, because I would want somebody to do the same thing for me. I'm gonna focus in, oh, by the way, and the second reason why we want to start those, why we want to know this risk factor list, beyond laying that preventative groundwork, number two is knowing that someone's at greater risk, being extra vigilant to see whether or not they're showing the signs and symptoms of someone who is considering suicide. And we'll talk about those signs here in a little bit. I want to hone in on a couple things here, and I'm going to combine trauma and adverse childhood experiences together. Trauma is an overwhelming situation that has happened to someone, a mentally, emotionally overwhelming circumstance. Adverse childhood experiences are ones that happen in the early developmental years. It can be abuse of any type, sexual abuse, physical abuse, mental, emotional. It can be neglect. It can be a child that grows up in a violent, abusive, neglectful environment, a child whose parents are incarcerated, a child who grows up in a home where substance use is common. That puts someone at a significantly greater risk, not only for suicide, but for other mental and behavioral health challenges as well. But what I also want to draw your attention to are a few things in this list, like drug and alcohol use, access to lethal means, bullying and peer abuse. We can do something about those. We can prevent those things, or we can at least attempt to prevent those things. So bullying in and of itself should be enough to spur us to action, to want to prevent it and want to intervene, simply to stop a child going through peer abuse. How much more should that motivate us to action when we know that bullying is a risk factor? Not only for suicide, it's a risk factor for self-injury. It's a risk factor for substance use in preteens and teens. So it's important to take note of this list, not only to begin the conversation early, to know who's at greater risk, but to work on preventing those risk factors that we are able to prevent. Now, Sarah's going to talk about protective factors. Oh, Sarah, one last thing before I continue on. Anything you'd like to add regarding these risk factors?
I think that this is a good segue as we're talking about risk factors. I mean, there are some risk factors that we can't necessarily control in a teen's life, but just identifying and knowing, hey, this is something that I need to be aware of. And then going on to protective factors, this is where the hope part comes in of prevention. There is something that we can do about it. We can layer on as many protective factors as we can for the kids and the people in our lives. And so the number one, strongest protective factor for a kid is that a strong positive connection to a healthy adult. And a lot of times that's the parents, that's that family. Sometimes it's not. Sometimes it's going to be that person at a school, whether it's a teacher or a coach. It might be their friends' parents, but just having that strong connection to a healthy adult is so important and protective for kids. Community support and involvement, access to mental health resources, which we are going to go over, and then healthy coping skills. It's so important to teach teens and even younger kids what they use for coping skills and ask them questions like, what do you do? What do you do when you're mad? Like, what do you do if you're feeling stressed out? What do you turn to if you want to like get pumped up? Like, what song really, really pumps you up? And just help them start identifying those tools that they probably already have a few, but help them identify like what are their coping skills, and making that go-to list for when something is going on. They already have those things identified. That's a huge protective factor that we can do for all of the kids in our lives, providing hope and optimism. Restricting access to lethal means is huge. And then cultural and religious beliefs is another big protective factor for teens. And, that can look a lot of different ways for families. Shane, I know that you have something else you'd like to add on here.
I do. And I'm going to go back to that first protective factor. It says strong family connection, but as Sarah highlighted, if it's family, that's fantastic. That's amazing. But as Sarah highlighted, we can replace that word family with adult. If a child does not come from a supportive environment, another adult can step up and fill that role. And the example that I want to use was a conference that I went to a number of years ago. And it was a conference for people who work with adolescents. And, we think we understand adolescents. We think we know what they want. We think we know how they think, but we got to hear directly from a panel of adolescents. And so they had a Q&A panel with about 7 preteens and teens, and the participants, the people that were at the convention, we were allowed to submit questions to have them answer so we could hear directly from them. One of the questions that somebody submitted was, who is the adult that was the biggest difference maker in your life? Who changed your life for the better? So as they went along, the 7 kids on the panel, the answers were pretty much what you would tend to think of first: parent, grandparent, parent, teacher, parent, grandparent, stuff like that. They got to the last person, and it was a 16-year-old young man. And he said, the adult that was the biggest positive difference maker in my life was the security guard at my school. She stopped me from killing myself. Not a parent, not a grandparent, not even a teacher or a coach. The security guard at this young man's school had the connection with him, created rapport, took the time, and stopped him from ending his own life. Every single one of us has the power to be that person for a young person or multiple young people. As a matter of fact, I'm willing to wager that the majority of you who are watching this right now already are that strong, caring, healthy, present, involved adult for at least one young person, if not more. So this is what we look for. There's 4 categories, and this is so important to retain this information. Number 1 warning sign is going to be direct verbal cues. These are direct references to death or suicide. Phrases like, I want to die, I want to kill myself. They're not as common as we think they would be, although sometimes they do happen. What tends to be more common are indirect verbal cues. No direct reference to death or suicide, but there can be kind of coded language in there if you read between the lines. These can be phrases like, I wish I could go to sleep and never wake up. I wish I was never born. I can't do this anymore. I'm so over all this. I can't handle life. You're all going to regret that later. No reference to death or dying or suicide in any of those phrases, but you can see where that may be pointing toward that, especially if you got somebody that falls in several risk factor categories and somebody else that's going to display some of the other behaviors that we're talking about here in a moment. Behavioral cues. These are things like someone who is suddenly giving away all of their possessions. Because if you're a junior high kid and you think you're going to end your life, your skateboard and your iPhone suddenly aren't very important to you. Someone who is no longer completing tasks like homework or chores or anything like that. Because again, if you're a young person and you think you're about to end your own life, your history, homework, and taking out the trash is not very important in the grand scheme of things at that point. Someone who is not normally very affectionate, giving lots of hugs and kisses as if they're saying their goodbyes. Someone who starts writing a lot of letters that seem like goodbye letters. Someone who is making amends and trying to make up for all the wrong they've ever done. Now, amends in and of itself is a great thing. But when you combine it with these other things that we're talking about, that can be someone who's wanting to right their wrongs before they leave this life. And then finally, situational cues. Situations that can occur in an individual's life that increase the likelihood that they are going to consider, attempt, or complete suicide. There were a lot of them on that risk factor list. So situational cues can be a child who is constantly bullied, a child coming from an abusive or neglectful environment, a child who has had a parent or multiple parents die, parents incarcerated, a child who is constantly uprooted and moved to a school every few months and doesn't get the chance to lay down roots and create those social connections. Think of these 4 categories together. Think of those risk factors. If you are thinking of a young person or any individual in your life and you are checking off multiple ones in these categories in combination, it is time to begin a conversation with that individual as soon as you possibly can. Sarah, what would you like to add on these?
So the one thing I want to add on that is a sudden, unexplained change in mood. So if we have a teen and they've been down for a while, we know about some things going on in their lives, and then all of a sudden they just seem relieved, maybe even happy, and it's kind of unexplained. Having a conversation about that is so important. Asking, hey, like, I know that you were going through some stuff, and today you seem, to be doing a better, to be a little bit happier. Tell me, like, what did you do to feel that way? And not only does asking that and starting that conversation eliminate the possibility of suicide, but it also starts that conversation to help teens start connecting. Well, what did I do? What did make me feel better? And that, once again, ties right back to those healthy coping skills to help solidify some of those connections that they can make in their life.
So when we start the conversation with them, it's important to begin with an open-ended question. Before we even ask directly about suicide, we need to get some more information about what's going on. So let's say that you see some of those signs and symptoms and your instinct is kicking in and things are telling you this individual is struggling with something. Sit down and begin a conversation. Turn your phone off. Don't look at your watch. Do this in a distraction-free environment. And begin the conversation with an open-ended question. It's okay, and it's actually good to mention some of the things that you've seen and heard that lead you toward this conversation. Hey, I've noticed lately that you really haven't seemed like yourself. You've been really down. You gave away a bunch of your stuff. You've said some things that make it seem like maybe you're hurting. Let's talk about what's going on, because I care about you so much and I want to help you. But I can't help you if I don't know what's going on. So let's talk about what's going on. So an open-ended question is a question that cannot be answered by yes or no. When they are sharing their experience with you and they are talking about stress and they're talking about anxiety and they're talking about hurt, it's important that we react with empathy. Even if as an adult, we're hearing a preteen or teen talking about what's difficult or painful to them, and we're thinking through our lens of adulthood, wow, that doesn't sound very difficult. I would love to have those problems again. We have to remember, in their eyes, in their experience, that is just as real as our stress and our pain is to us. So if we can make statements back like, I can tell from what you've said to me that that's really painful for you, or I can hear in your voice that this is really difficult for you. Recognize and feel with them. Recognize and validate their feelings and the hurt. Use appropriate body language. Sit down, make eye contact, allow them to break eye contact. As I mentioned earlier, have your phone turned off. Don't be checking your watch. Make it clear to them, I am here with you in this moment. The world can wait, and I will take whatever amount of time is required that you need. And then if you've gotten to this point where you've seen enough, you've heard stuff in the story that you're hearing from them right now that you're thinking, this is adding up towards suicide. Not only is it okay to ask directly about suicide, we need to. And we need to keep it really simple and basic. Only ask one of 2 ways. Are you thinking about suicide, or are you thinking about killing yourself? Down in the chat box, I'd like to hear from you. Why would you not want to ask the question this way? You're not thinking about doing something stupid, are you? Why would you not want to word the question that way? And I'll repeat it again. If you're asking someone, let's say you think they might be suicidal, you're not thinking about doing something stupid, are you? Down in the chat box, let me know, why would you not want to ask the question about suicide that way? We got an answer right here. Minimizes everything they are going through. Absolutely. Puts them on the defense because it's basically calling them stupid and might shut them down. I'll give you a few more moments here. It can be confusing to the person to know how to answer. It belittles their feelings, makes them feel like their feelings are wrong. And that's another one too, that'll make someone think, I can't talk to you. Even if I take that word stupid out, listen just to the tone. You're not thinking about killing yourself, are you? That tone alone says, because if you are, don't tell me, I don't want to know. We ask confidently and clearly, and I understand it's emotional. It's not an easy question to ask. I recognize that. But if we show them that we can ask it with confidence and clarity, and we make it clear to them, you can answer this question honestly, they realize I can talk to you. This is someone that I can be honest with. And we see right here, they won't want to talk about it anymore was another answer. Another question right here before we move on, I'm actually going to address this question. What if they say no, but you're very concerned that that's not a true answer? I would continue the conversation. You can maybe take a step back on that to where you're not pressing them several times in a row on that question, but I would hang back and say, you know what, I'd like to hear a little bit more about what's going on. If they say no, may be a matter of them not feeling ready to say it yet. It may be a matter of them not feeling comfortable saying it yet. So it may be a matter of they're going to say it when they're ready to say it. So what we can do is we hang back and take a little more time. Later on, it's okay to pose that question again. It's okay to ask that question again, gently, kindly, and diplomatically. But I'm so glad that you asked this question. If your instinct is telling you that the no answer that you're getting is not correct, follow that instinct. Continue that dialogue. Continue with some of those open-ended questions and explain to the person, you know, I'd like to hear a little bit more about what's going on so I can understand. Because you said that you're not thinking about suicide. I do want to understand what you are thinking about, though. What is going on? Because I want to help you. And if I don't know what all's going on, you know, I can't be really helpful towards you. And what this all adds up to is this. You want to build a bridge to this person. This individual who is suicidal thinks that no one cares, no one ever will, and they have no hope. We need to make it clear to them, I care. I am here in this moment with you. I will do what is within my power to help you. There are other people out there who care, and I am happy to connect you with them, and there is hope. It may seem very small right now. So we're creating the bridge to this person that thinks that they're on an island, and we want to show them, I'm here in this moment with you. And while we are doing this, one of the most powerful things we can do is something that we are all capable of. Sergeant Kevin Briggs was a highway patrolman, California Highway Patrol officer, who for several years patrolled the Golden Gate Bridge, a very popular destination for suicide. He stopped multiple people from suicide on the Golden Gate Bridge. As a matter of fact, I highly recommend this TED Talk that we took this 40-second clip from. It's called The Bridge Between Suicide and Life. Once again, The Bridge Between Suicide and Life, Sergeant Kevin Briggs. Here's a quick clip of him talking about one of the individuals that he stopped from suicide and what the difference maker was in that moment.
On March 11th of 2005, I responded to a radio call of a possible suicidal subject on the bridge sidewalk near the North Tower. I rode my motorcycle down the sidewalk and observed this man, Kevin Berthia, standing on the sidewalk. When he saw me, he immediately traversed that pedestrian rail and stood on that small pipe which goes around the tower. For the next hour and a half, I listened as Kevin spoke about his depression and hopelessness. Kevin decided on his own that day to come back over that rail and give life another chance. When Kevin came back over, I congratulated him. This is a new beginning, a new life. But I asked him, what was it that made you come back and give hope and life another chance? And you know what he told me? He said, you listened. You let me speak, and you just listened.
Kevin Berthia is alive and well today, and he is actually now using his experience as someone who had considered suicide to use as a platform to help other people. I'm actually friends with Kevin Berthia on Facebook, and he is someone that is doing incredibly well. He is thriving today. He and Sergeant Briggs have reconnected a couple times over the years. And what an incredibly powerful story. But the biggest difference maker in there was something that we're all capable of doing. I mentioned that I teach a 2-day, 14-hour suicide intervention workshop called Assist. 2 days, 14 hours. That's an involved workshop. The bulk of the model that we teach is focusing on listening, and not listening for what we want to hear, what we think we're going to hear, but really listening to what they're saying. Because if we're not truly actively listening, we may miss something very important. We may miss a turning point in their story where they are unsure about suicide, where we find a little glimmer of hope, where we find a coping skill, where we find some resilience, where we find someone that they are connected to. There is someone that I helped that was dealing with thoughts of suicide. And the difference maker in this individual, which was mentioned very briefly and very subtly in the conversation we had, was their pet, their dog. They did not know who would take care of their dog if they ended their life. And it was breezed over very briefly and very subtly in our conversation. And if I had not been listening, I would not have recognized how important that animal was to that individual. Sarah's now going to let us know how we can respond. Actually, it looks like she may be typing an answer to a question, so we'll give her 1 second here. Oh, Sarah's answering the question down in the chat box I see there. Sarah is going to answer how to respond.
Right. So when responding, when listening, take time without overreacting. And this is easier said than done, especially if you're talking to somebody that you really, really care about and they're saying things that are bringing up a lot of emotions in yourself. So just being aware of your body posture, your facial expressions, and letting them share and maintaining composure while they're sharing so that they continue to feel comfortable sharing. And being an active listener, similar to the things that Shane was saying, empathetic statements, repeating back and summarizing what you're hearing to make sure that when you're listening, that you're actually listening to what they're saying, not, like Shane said, what we want to hear. And then not rushing to judgments. If somebody is sharing, it's important just to give them that space to share without making assumptions or judgments about their situation. And another one is to, like I said, not lose your composure. And so the listening phase can be some of the most difficult things that we're doing when we're helping somebody. When you're listening to somebody share, if they're not saying anything, that's okay. Sometimes they just need some space to sit there for a moment and they'll start talking again. And so creating that safe space is really important. And then for, the kids in our lives, if something and they're sharing and they're talking about something that, maybe is something that needs to be addressed later down the line, with a situation that they're in where they made some choices. That's something that maybe after you're done with this conversation, you can address maybe some unhealthy choices that they made down the line. But when we're sitting and we're listening and letting them share, it's important that we don't bring up punishment and immediate consequences for their actions and jumping to that. We just need to let them share and continue to create that safe space.
And one thing I want to mention, I want to double check with all those of you in attendance right here. We had someone mention down in the chat box that they are unable to hear. Can some of you please indicate down in the chat box that you are able to hear? I want to make sure that it's not an issue with us, that maybe that individual has their computer turned down. I'm going to jump back here real quick to a question that we had. This is a very good question right here. What if the child is not considering suicide? By asking, am I putting the idea in their head? Would it be perceived as a suggestion? That may be, and Sarah can verify this, that may be one of the questions that we get most commonly. Like that goes back to the slide where we talked about the suicide myths, where talking about it will only make the individual more likely to act it out. Research has shown time and time again that we are not going to plant that idea in their head. It's the kind of thing where in the society that we live in now, by the time someone has reached especially junior high or high school age, they are aware, they've heard the concept of suicide. If someone is going to breach the topic with them, better that it is us, a caring, healthy parent, who can guide them carefully and correctly through the topic than someone on pop culture or social media who throws out a reference in a destructive way. By the time they're in middle school or high school, they have heard the word suicide. They're somewhat familiar with the concept, though they may not be familiar with it in a healthy way in terms of the fundamentals of mental and behavioral health. So better that we, as a caring, healthy adult, ask them than someone else making that reference elsewhere. It's a very good question, and I get asked that so much. But like I mentioned earlier, before I worked in this field, I was afraid that if I brought it up, I would be planting that idea. And it's actually been shown time and time again through research that we're not going to plant that idea and we're not going to make that person do that. But that's a really good question. Thank you, by the way, to all of you who verified that you are able to hear the audio. And Sarah is going to talk to us a little bit, she touched on this briefly on the last slide, a little bit about the communication pyramid.
So much of communication is not about exactly the words that we're saying, but how we're saying it. The paraverbal and nonverbal. So that body language, like I said, the tone, the facial expression is going to send most of the messages to the person that we're talking to outside of what we're actually saying. And so just keeping that in mind, you know, as we're working with somebody who possibly has thoughts of suicide.
And Sarah, if you'll talk about what do we do next? So let's say we've reached that point where somebody discloses to us, yes, I have been thinking about suicide. The $1 million question, what do I do then?
Yes, and so a really popular line is the Suicide Prevention Lifeline, 1-800-273-TALK or 8255. There are crisis response teams, or you can call 911 in that emergency situation. Take them directly to a professional or a behavioral health agency. It's so important that they get connected with long-term support. Provide options. So if somebody does say yes, and we're sitting down and you're saying, okay, well, we can call the Suicide Prevention Lifeline. We can call or text the crisis line, or, we can call the doctor right now and schedule an appointment. What would you like to do? Give them options where all of those options are leading to get help, but that they still feel like they have a sense of control over what is going to happen next. Make sure that you close the loop and that you get that commitment, that you get that plan in place, and monitor them closely. That's really important.
And I'd like to add onto this a couple things right here. That phone number, 1-800-273-8255, is the National Suicide Prevention Lifeline. We live in an era where every single one of us at almost every given moment of the day is walking around with our phone on us or near us. I highly encourage every single one of you to program that in your phone. If you don't feel like you're going to use it for yourself or a family member, you never know. You may run into someone at the grocery store and need that resource. The other thing I want to mention here about connecting them to professional help and then closing the loop, getting a commitment. If someone has disclosed to you that they are suicidal and they have the intent, they have the plan, and they have the means, suicide may be imminent. We cannot leave them alone. We have to do what is called a warm handoff. Connect them to someone who is willing, ready, and able to take it from there. When we connect them with this next person, it is so important that we be completely clear that this individual has disclosed to me that they are considering suicide, because the person taking it from there needs to know what is involved here. In order for them to be fully equipped to help this person, they need to understand this person has been considering suicide. Provide as much information as you can for that person where you're doing the warm handoff. And you cannot leave that individual by themselves. By the way, if you don't know where a behavioral health agency is, let's say it's 3 o'clock in the morning, it's a holiday. As Sarah said, you can take them to an emergency room. It's not ideal. Like if you can get them connected to a specific behavioral health or mental health agency, that's great. But if you're limited on options, an emergency room will put a hold on them. They will have them evaluated. They will get them connected to care. It's much better than leaving them by themselves. A couple resources before we get into Q&A for you. Please write this down, take a screen capture, however you want to keep a record of this, notmykid.org/DEP, notmykid.org/DEP. you will find our online resources for depression, self-injury, and suicide, including a lot of the information that we gave here. You will get the complete list of signs and symptoms that we talked earlier. You will get tips on how to start conversations with your preteens and teens. And perhaps most importantly, you will get a link to a family prevention plan. You see that link that says in the orange lines near the middle of the screen, it says take action, create a family prevention and intervention plan. Sit down with a couple blank pieces of paper. If you have a spouse or a partner involved in the raising of your child or children, sit down as adults first. Go to that link, go through these resources, and go through that creating a family prevention plan. Use those suggestions to form your plan. Take those tips and customize them based on the specifics of your family, your morals, values, principles, guidelines, your living situation, the age of your kids, the maturity of your kids. Form a plan. Agree to it as adults before you bring it to your kid. Then once you have formed it and agreed upon it as adults, take it to your child. Take them to dinner, make them their favorite dinner, and sit down and dedicate some time and say, we feel like we owe it to you to be clear what we expect of you and what you can expect of us. Here's our part in it. Let them look through it. Ask them, what do you think of this? Let them amend it. Let them add to it. Let them be part of the process, because if you let them be part of the process, you will get more buy-in from them. It'll feel less dictated to them. But I ask that you not let them cross out anything that you have put on that list. Then come to an agreement. Some families have everybody sign the plan. Sometimes it's a handshake agreement or it's a verbal agreement, because if the rules, the understandings are clear, they're concise, they're consistent, they're intentionally agreed upon in advance, you are more likely to have a positive outcome. A very important resource that I want to offer you, that we want to offer you, is our podcast. You can find it on your favorite podcast platform, Apple Podcasts, Google Podcasts, Spotify, Amazon Music, Amazon Alexa, iHeartRadio, you name it. Or you can go directly to the hosting site. The website, the podcast is called Win This Year. I'm the host of it. We are now 33 episodes in. We aim to have every episode be informative, interesting, and inspiring. We cover topics like suicide, bullying, safe social media use. We have talked with parenting experts, mental health professionals. We have talked with parents who have lost their children to suicide or to overdose, so that we can learn from them, because these parents want to use their experience to make sure other families don't go through the same thing. What I encourage you to do, if you have found this information today valuable, go to our podcast and scroll all the way back to the very first episode. We released it 2 years ago today, September 10th, 2019, World Suicide Prevention Day. It is a podcast featuring a mom named Paula Jordan, whose son, Audra Romine, was valedictorian of Chandler High School, pre-med at ASU at age 16, brilliant, loving, altruistic young man. And a couple days before Mother's Day 2019, he ended his own life, based partially in suggestions from a stranger who was coaching him through social media on how to take his own life. Paula has since gone out and, in response to his son's situation, gotten legislation enacted to address what went on in her son's case. It is a powerful episode. And in the second half, Geronda Montano and I talk about a lot of the suicide intervention and prevention methods that Sarah and I talked about here. And one more resource before we answer your questions. On Facebook, you can look up Not My Kid Families, Not My Kid run together as one word. It is a private Facebook group for parents, grandparents, guardians, educators, mental health, youth mental health workers. It is a supportive private community where we can share resources with you, information when there's breaking news related to substance use. Maybe there's a new drug trend, there's a new app you need to know about on social media. But what's really great is this. It's the power of parents supporting parents. You can get on this group, and if you're dealing with a challenge with your child, you can post a message and ask a question, even anonymously if you want to ask it anonymously. And we have seen parents go in there and post questions and say, hi, we're the parents of a 14-year-old girl. Last school year, this happened. Has anybody else been through this? What do we do about it? And we'll answer, not my kid will answer, but then 2, 3, 4, 5 parents will answer. And instantly this parent realizes they're not alone, they're in good company. And then other individuals are giving them tried and true methods that they've used when their kids were in that similar situation. And nobody understands a parent like a parent. Now, before we get into the Q&A, there was a question down here in the chat box. When and how will the recording be available later? Sarah, we are syndicating this to Facebook right now. Is that correct?
We are. So there will be a recording available on our Facebook, just notMYkid on Facebook. And then anybody who registered for the webinar will also be emailed a recording link.
Awesome. Excellent. Final thing. Before we answer, I see there's 4 items up here in the Q&A tab. These are the links to contact us through notMYkid. If you think of a question that you don't want to ask right now, or you think of something later, your child is dealing with a challenge, you need to get connected to our mental or behavioral health support, this is how you do it right here. Now, I'm going to click on Q&A, and I can actually see it this time. Excellent. Wasn't able to see it the last few webinars. Question number 1 was, when and how will the recording be available later? We have answered that. I can hear, yes, I can hear. And will these resources be shared with us participants after this training? So it looks like thus far we have answered all of those questions right there. Sarah, before we give people a chance to type any additional questions they may have, what else would you like to add regarding our mental health services, outpatient, or anything else before we wrap up? Because we got a couple minutes left here.
Yeah, so if you would like to get your family connected to any of our behavioral health services, you can go on notmykid.org, go under the behavioral health tab, and then there's a link, and then you fill out a quick form. We contact you within 24 hours, and we have a family support specialist who will be calling, listening to your unique situation, and providing resources that are most appropriate for you and your family, whether that's notMYkid or other community resources, because we are connected to a lot of other agencies and resources in the community too.
And one thing I'll mention for those of you who are watching the mirrored version of this on Facebook, we will check back in a little bit to see if there are any questions that have been typed, and we will answer those by hand. We will type out those answers to you here shortly. We just got another thing here in Q&A saying informative training, thank you. Before we wrap this up, one last thing I want to add is thanking you all again. I thanked you when we started this webinar, but I want to thank you again. This is obviously a topic that a lot of people shy away from. As I mentioned earlier, very few things in life, if any, can we improve by not talking about them. It takes courage to sit and listen about this topic. It takes courage to talk about this topic. But doing so genuinely has the power to save lives. I can tell you that firsthand. I have been blessed and fortunate enough to use this very information that we're using here today to prevent multiple suicides. And I am not a superhero. I'm not particularly talented, but what I was willing to do is take the knowledge that I do have to be vulnerable, to be there and hold space in that moment with that individual. And those people whom I've helped to choose life, when I look back at the most valuable things I've done in my entire life, that's up there near the top. Every single one of you has the power to be that person. So thank you so much. You could have been anywhere for this last hour, but you chose to spend it with us. Thank you so much for being part of the solution, and thank you for sharing your time with us. Sarah, anything before we close?
Yeah, so I mean, I just have one thing that I would really encourage everybody here to do. It's World Suicide Prevention Day. A great way to just start that conversation is say, hey, did you know what today is? So I went to this webinar, I learned a bunch of information, and let everybody in your life know you can talk to me about suicide. I just want you to know I'm a safe person. You can put that out there right now, and you never know who in weeks or months or years might come to you because you put that out there today.
One last thing, I want to make sure before we drop off here, I got a question. This is really important. I want to make sure that I answer this. This is a very good question. What do you recommend when a suicidal student is taken to an emergency room for evaluation, but then returns to school the next day complaining that they didn't get any help? I am guessing that based on you're talking about them returning to school the next day, that you work in education. What I would do at the level that you are at, what you have the ability to do at that point is if your school has a psychologist, a counselor, and or a social worker, I would make sure that that individual follows up with that student. So I apologize if you're actually a parent, but the way you worded this makes it sound like you are interacting with this individual in a school setting. So the relationship between us, as those of us who work with youth in our professional capacity, and the kids in our lives as parents, as us being parents, what we're able to do in those two situations is very different. So what you would be able to do is definitely let the school psychologist, social worker, and or counselor know to follow up with this student and make sure that they are aware that this student was suicidal, that they had been taken for treatment, and they felt like their needs were not met because that individual is at significant risk based on those factors right there. So thank you so much again. Thank you to Sarah for being awesome as always. And my name is Shane Watson, Public Information Officer and Prevention Specialist for notMYkid. Thank you for being here, and thank you for being part of the solution.
Thank you.